The Code, Part 4. Preserve safety. You make sure that patient and public safety is not affected. You work within the limits of your competence, exercising your professional duty of candor, and raising concerns immediately whenever you come across situations that put patients or public safety at risk. You take necessary action to deal with any concerns where appropriate. So in this paragraph, the meaning of duty of candor is about openness and honesty when things go wrong. So every healthcare professional must be open and honest with patients when something goes wrong with their treatment or care which causes or has the potential to cause harm or distress. Number 13. Recognize and work within the limits of your competence. To achieve this, you must, as appropriate, accurately identify, observe, and assess signs of normal or worsening physical and mental health in the person receiving care. You must make timely referred to another practitioner when any action, care, or treatment is required. You must ask for help from a suitably qualified and experienced professional to carry out any action or procedure that is beyond the limits of your competence. You must take account of your own personal safety as well as the safety of people in your care. You must complete the necessary training before carrying out a new role. Number 14. Be open and candid with all service users about all aspects of care and treatment, including when any mistakes or harm have taken place. To achieve this, you must act immediately to put right the situation if someone has suffered actual harm for any reason or an incident has happened which had the potential for harm. You must explain fully and promptly what has happened, including the likely effects, and apologize to the person affected and, where appropriate, their advocate, family, or carers. You must document all these events formally and take further action if appropriate so they can be dealt with quickly. Number 15. Always offer help if an emergency arises in your practice setting or anywhere else. To achieve this, you must only act in an emergency within the limits of your knowledge and competence. You must arrange wherever possible for emergency care to be assessed and provided promptly. You must take account of your own safety, the safety of others, and the availability of other options for providing care. Number 16. Act without delay if you believe that there is a risk to patient safety or public protection. To achieve this, you must raise, and if necessary, escalate any concerns you may have about patient or public safety, or the level of care people are receiving in your workplace or any other health and care setting, and use the channels available to you in line with our guidance and your local working practices. You must raise your concerns immediately if you're being asked to practice beyond your role, experience, and training. You must tell someone in authority at the first reasonable opportunity if you experience problems that may prevent you working within the code or other national standards. Taking prompt action to tackle the cause of concern if you can. You must acknowledge and act on all concerns raised to you. Investigating, escalating, or dealing with those concerns where it is appropriate for you to do so. You must not obstruct, intimidate, victimize, or in any way hinder a colleague, members of staff, person you care for, or member of the public who wants to raise a concern. You must protect anyone. You have management responsibility from any harm, detriment, victimization, or unwarranted treatment after a concern is raised. Number 17. Raise concerns immediately if you believe a person is vulnerable or at risk and needs extra support and protection. To achieve this, you must take all reasonable steps to protect people who are vulnerable or at risk from harm, neglect, or abuse. You must share information if you believe someone may be at risk of harm, in line with the laws relating to the disclosure of information. You must have knowledge of and keep to the relevant laws and policies about protecting and caring for vulnerable people. Number 18. Advise on prescribe, supply, dispense, or administer medicines within the limits of your training and competence. The law or guidance and other relevant policies, guidance, and regulations. To achieve this, you must prescribe, advise on, or provide medicines or treatment, including repeat prescriptions, only if you are suitably qualified. If you have enough knowledge of that person's health and are satisfied that the medicines or treatments serve that person's health needs. Keep to appropriate guidelines when giving advice on using controlled drugs and recording the prescribing, supply, dispensing, or administration of controlled drugs. You must make sure that the care or treatment you advise on, prescribe, supply, dispense, or administer for each person is compatible with any other care or treatment they are receiving, including over-the-counter medicines. You must take all steps to keep medicines stored securely. You must, wherever possible, avoid prescribing for yourself or for anyone with whom you have a close personal relationship. Prescribing is not within the scope of practice of anyone on our register. Nursing associates don't prescribe, but they may supply, dispense, and administer medicines. Nurses and midwives who have successfully completed a further qualification in prescribing and recorded on our register are only people on our register that can prescribe. Number 19. Be aware of and reduce as far as possible any potential for harm associated with your practice. To achieve this, you must take measures to reduce as far as possible the likelihood of mistakes, near-miss, harm, and the effect of harm if it takes place. You must take account of current evidence, knowledge, and development in reducing mistakes and the effect of them, and the impact of human factors and system failures. Human factors refer to environmental, organizational, and job factors, and human and individual characteristics which influence behavior at work in a way which can affect health and safety. To achieve this, keep to and promote recommended practice in relation to controlling and preventing infection. You must take all reasonable personal precautions necessary to avoid any potential health risks to colleagues, people receiving care, and the public.